Hello, I'm Dr. Elisa Peavy, and welcome back to Quantal U, Episode 9. Today is a special episode, and although our next guest is very skilled as an osteopathic and craniosacral physician, this was not the meat of the interview. I was pleasantly surprised at the direction it took. Not only do I feel very strongly that this needs to be seen by all my subscribers, but I also feel that all physicians and patients should be watching this, as it's that powerful. So I first met Dr. Roman in the hospital at my younger sister Wendy's passing in 2017. She had been her physician since the birth of her son Nolan almost 9 years earlier. Interestingly, I first came across her name when my brother and sister-in-law were desperately trying to find someone to help with their infant son's cranial abnormality that he'd had since birth. He was approximately 4 to 5 months old, slept horribly, cried almost constantly, and it was obvious that he was very uncomfortable. I went to my OMM professor in medical school and asked if he knew of any craniosacral docs in the Boise, Idaho area, and he came back with Dr. Roman's name. Since that time, she's both treated and cured the cranial abnormality, and then started seeing my sister and her new infant son a couple of years later. And while I knew that Wendy had developed an incredible bond with Dr. Roman, at the time of her passing, I had no idea the extent to which their bond had grown. And now in looking back, I can tell you how incredibly grateful I am that my sister had a physician like Dr. Roman. I imagine the potential impact I could have had with my own patients diagnosed with cancer had I been able to spend the time that they needed. How beautiful and special that must have been for my sister. And the truth is that everyone should be privy to that kind of care. We all deserve that type of a relationship and rapport with our doctors. As physicians, it's a privilege when patients open up and tell us their most vulnerable secrets. We should not expect that they tell us everything. We have to earn their trust. And in doing so, the patient-physician relationship will only strengthen, improving the health of not only the patient, but the physician too. Now, isn't that amazing? Unfortunately, our ability to positively affect the lives of our patients is difficult due to the current medical system construct. And because of this, we not only suffer more in terms of stress, but so do our patients. Currently, physicians have the highest suicide rate of any other profession, where one physician is committing suicide every day. This is the equivalent of about 300 to 400 deaths by suicide every year, pointing to and confirming the facts that not only is it important that you're aiding your patients, but you're also helping yourself to take care as well. You need to look at your own patterns. You need to clear your own emotional trauma, because we are not immune to disease, and we most certainly are not immune to stress, as it can impact our lives in a negative way as well. So do your work. Take a look.
My name's Deb Roman, and I have an osteopathic doctor degree, a DO degree, and I'm a physician. Went to Kirksville College of Osteopathic Medicine. When I finished my residency, I went out into practice, and at that time, basically we would see patients and we would see them in the office all day, and then we would go to the hospital and see anybody that was hospitalized at night. And it was a different world. It was a way different world at that time. There was a lot more communication between all the specialists and all the physicians who were in practice, in private practice. There was a lot more continuity because my patients knew that if they were going into the house, I would be there to see them at night, and I could let people know everything I knew. It was a world where we sat across the table from other physicians on a regular basis when we went into the hospital, and had a very cohesive group, community-wise, and very close relationships with the nurses and other practitioners. Much has changed as we've moved to hospitalists, and a lot of the regulations that we've had in the last 20 years have really changed. In my opinion, one of the biggest things is it's really affected the community, because we're also isolated. And so I really missed that piece where I would go in at night and see all my friends, and we would always be able to talk about what's going on and get ideas from each other in a very casual way. And I also loved the continuity of patient care. So patients knew that they weren't going to just see somebody that they didn't know, that I would always be kind of that person that would be kind of in the middle of that, helping them navigate. And I think that many of the regulations, I've done a lot of work with physician well-being, and we're very clear on burnout and a lot of the frustrations. A lot of the regulations have added so much to the plate that physicians are dealing with, that now it's not just about patient care, it's not just about us sitting here talking, it's filling out forms and doing lots of things on the computer and having all these extra regulations. So in my practice, particularly, that's kind of a global, but in my practice, I feel that I did family medicine and hospital medicine for many years, and then I thought, I want to spend more time with people, and it was already starting to change. So I was already starting to get regulated in terms of the amount of time and things I could do. So I kind of stopped doing that work and decided that I would spend an hour to 2 with each patient and develop a different model. I always spent a lot of time, but some of that was starting to change. And that's been really beautiful. And I've also spent some time really advancing some of my skills with hands-on osteopathic work. And so started out on my own to just meet with patients on a regular basis and kind of sit down. First visit's usually about 2 hours, and we go through everything that they're going through and why they're here, and a very comprehensive history. Some physical is needed, but osteopathic work as needed. But really just kind of sitting down and talking more about health than disease. So that's always been my focus, is that, and that's really been my training. Osteopathic work is based in health, finding health, right? Not looking for disease. Root cause, right? Finding what's the source, what are the sources, right? And I love working with patients where, it's a partnership. And so in order to do that, we need time. They can't just come in and have 10 minutes and tell me what's happening, and then we go on to figure out what to do. It's listening and figuring out how we together can find health for them. Many people see that. That's really what medicine was always. Like your dad, I'm sure that's how he's always practiced until things changed. It was always about the relationship, the relationship with the patient, and it nourishes both of us, right? And so all of this stuff has gotten in the middle. And I think patients are asking for this. They're like, who will listen to me? Who will take the time? I text a lot with my patients, and they know they can reach me in between, and it's a privilege. Honestly, it's a privilege, right?
Yeah.
For you as well.
Absolutely.
You're taking a different course as well because you see the same thing. It's such an important piece, and those are the same people that are feeling the same things we're talking about, that are saying, I want to spend time with people. I want to give them, the best care I can. And the direct primary care model is so wonderful because a lot of the time they're negotiating fees. So an MRI that would be $2,500 is now $600.
Yes.
And so lab work that would be $600 is now $40. And so, or 300 would be $40, something like that.
Right.
People can afford that. So, I think it has great potential. Well, stepping back to the osteopathic training, where I've learned to work with my hands, to listen to the body. So, doing that requires you to really develop your skills of intuition and palpation, sensing. I guess intuition incorporates sensing, right? So, and my teachers have been very clear that the body is much smarter than I am, and if I can learn from it, I'll help more people. And so over the years, I've really developed, and I continue to develop my ability to sense what's happening in someone's body. But intuition, I think sometimes it gets a bad name, like as if it's something that's kind of mystical, but, any parent knows, when their children come in the house and they're not feeling well and they're like, oh, you're sick. And they're like, no, I'm fine, Mom. And you're like, no, we're going to be up tonight, right? That's a form of intuition, right? You're sensing on a more global level what's going on. So I don't think it's really anything unusual that we don't use on even a daily basis a lot of the time. But I think it can be cultivated to a point where you can use it for healing. So certainly in my work with hands-on work, I have to be very attuned to my sensing of what the body's telling me, how it wants to heal, what I can offer to patients about that, what I've learned, and share that with them. And often even just in these kinds of conversations, when we're sitting talking to each other, if you take the time, which you value as well, you're listening for, are you comfortable? Is there something else that we need to be dealing with? How did your body react when we just talked about that? You're sensing those kinds of things, and then you can work off of that and bring some more of that information to the patient. So it's a big question. It's a great question. I haven't really been asked that kind of a question before, but and I would offer with intuition, it requires incredible humility. The recognition that I don't know, that you probably know much better about your body. You do know much better about your body than I do. So am I willing to really listen and reflect back to you what I see, what I hear, what I'm sensing, and then you do the same, and we start to learn how to do that together. I'm always hoping that my patients actually learn to read their bodies even better and better, and very often they'll come in and they'll say, Deb, this is what's going on. And I'm like, okay, that's good, let's take a look at that. And that takes time though, right? Sometimes we're an hour in, and somebody will say something and it'll be like, oh, there it is. That's it. That's the piece. That's the source that's causing this suffering and disease. Now how do we get to it in a way that the other person wants to get to it? It's learning their story. Mm-hmm. They bring in their story, and that's a privilege that they choose to share that with me. It's interesting, I've been working with medical students and we've been doing some teaching in small groups, and I say to them that, you know how we have these forms now where they'll ask you everything about your life, including every single detail, before you even see a doctor. And I say to them that we have to earn that trust. They have to have the time to sit down and be willing to tell me they were addicted to drugs, and that's been a hard move for them. And I have to earn that. I don't really have the right to ask that information unless it's life-threatening. Maybe I need to get some details, but other than that, I really feel like I have to wait until they're ready to talk to me. I think we all have that potential, but we're put in a system that doesn't allow for it. Right? I think doctors go in with really great intentions and they want to help people, but like you say, you can't do it in 15 to 20 minutes. And many of these very deep, personal things, they take time. I had a patient come in recently, and we spent probably an hour together, and there were lots of things going on, and then I said, why don't we do an osteopathic treatment, and I'll be able to tell you more about what your body's telling me, and that might help serve you more, but also we'll work on, facilitating health the best way we can. So I said, well, I'm just going to take a moment, I'll be back in a moment, and we can talk about it. And she just laid down on the table. So she said, Deb, I lied to you. And I said, what do you mean? And she said, well, I did do a lot of drugs, and I do have trouble with alcohol. And my comment was, you didn't lie to me, you just needed to trust me enough to tell me. That's your right. Where does the healing happen? Where does the magic happen? And this was this idea that you have a patient and you have a physician, And then we bring this information to the space between us. You share, and I'm reflecting you as if you were a patient, but you share and I share my thoughts, and we reflect all this back into this center space, and that's where the alchemy happens. You know, it's not just me projecting to you what I think you need. I don't like the term doctor's orders. I feel like, you know, who am I to say that I know what you need? I'm just going to give you the best advice I have. You know, you never know what's going to happen in a treatment, right? Or in a session. It's like, you know, talking to you this morning. I wouldn't have been able to plan what we were saying, right? So we wait and we see what comes up, and then we can learn from there. Some of these changes in the laws and the regulations and the increased documentation, the number of physicians that are now employed as opposed to having their own practices. There's been so many changes over the last 20 years. I truly feel that they have affected the health of physicians. And we know this to be true because the research shows that more than one physician per day takes their life to suicide. That's probably highly underestimated because physicians are probably, you're not going to know sometimes, right? You're not going to know whether that was from suicide. And they're not going to often reach out when they're in distress because there's issues about their licensing or just feeling like, you know, are they going to be able to do their work, things like that. So we've really recognized that there's a crisis, and it's a huge crisis. It's not just, it's a public health crisis. It's not just some small thing that's happening, and it has nothing to do with the abilities of physicians or any kind of weakness or, you know, inability to cut it. Docs are working as hard as they can. It's just not a system that works. It interferes with the relationship that we have with patients. It interferes with our relationship with peers. And the meaningfulness of the work that, it doesn't go to our heart, like you're saying, right? The meaningfulness of our work comes from doing our work, not from clicking things on computers. You know, the amount of pajama time that people spend clicking on computers after work is significant. And so that doesn't give us nourishment, it just wears us down. So I've worked with we've put together a couple of conferences over the years, bringing in some of the researchers from Mayo Clinic and around the country. We've worked with the Ada County Medical Society to put together what's a physician counseling program that's completely confidential so that docs can go see a counselor on their own time without feeling like it's going to affect their licensing or anything like that. There's no records that are electronic. There's no billing, so that they can go in and take care of themselves when they need to. It's a really wonderful service for docs. 8 free visits during a year as part of being part of the membership. And we've done lots of dinners and conferences. We've put together discussion groups, and I would offer to you that's been one of the most valuable pieces, is just providing places for docs to come together to say, what are you dealing with? And to know that other docs are dealing with it, and to really look for solutions, not just complain, but to say, what can we do about this? How can we organize in a different way? Or is this job really the best thing for you? Should you step away? Some people refer to this as moral injury, right? And clearly it affects you, right? And it affects me too, and it affects so many of our colleagues. And to not be able to provide to patients the kind of care that we really feel they need, to not be able to work in an environment that's nourishing, that feels, you know, we're willing to put in the hours. That's never been an issue, you know, and we still feel enthusiastic and engaged if we're doing the work. Yes. But if we're being forced into little into situations where we don't have that kind of autonomy to figure out what's best needed at this time, it's so destructive, right? And you pointed to your heart, like it affects our heart. right?
Yeah.
I mean, it really affects us on so many levels, and physically we know it absolutely is. And then we start to dissociate, right? When we pull back. The emotional exhaustion, the emotional exhaustion is not actually the primary piece of burnout. People are finding that it's more the cynicism, the jadedness, the dissociation, and that's a defense so that we can function, because we're in people equate that to being in war and being asked to do things that you just know don't fit with your moral code in any way. I think many physicians are feeling that now. And so luckily, we're finding different ways for ourselves and for our patients. And I don't know of any doctor that has walked away from that system that has come to me, because I do a lot of individual work with docs, and same kind of thing. Let's figure out how to get healthy. It's no different, really. Who has said to me, that was not a good idea. They're always like, I'm taking a lot less money. The bills are hard to pay right now because I've had a lot of debt. But I feel so much joy each day because I'm doing something I really believe in. Like I mentioned earlier, it's a circle. We take care of each other. I remember this wonderful time where this, patient, she was like in her 80s and she was super nervous. I was working back east at the time still, and so when she would call me, I would try to call her back fairly quickly because I knew she always got really anxious about things. And I had this terrible flu. I was so sick. But it was about 8 o'clock at night, and I knew she really needed to talk. So I called her back, and Mary, what's happening? And she goes, Dr. Roman, is that you? Oh my gosh, you are way sicker than I am right now. What I want you to do right now is I want you to go get a cup of tea, and I want you to lay down in bed and cover yourself up, and do not call me back until you feel better. You understand what I'm saying to you? And I'm like, and I said, okay, Mary. And I said, are you Dr. Roman? Did you hear what I said? I said, okay, thank you, Mary. And she goes, okay, honey. It was the cutest thing when she, okay, honey, I'll talk to you next time. But she took care of me. That's so awesome. Right? And we know that. We know that in taking care of our patients, right? They take care of us too. But it's, we have to have that relationship and that time. Oh, I've seen lots of profound healing. There's so many stories. Let me take one story that I've talked about before. A patient came into me with pancreatic cancer, and his first comment to me was, I have 3 months to live. And he was kind of a tall and foreboding figure at times, right? And he said, but it's my fault. It's my fault. I drink too much, and I haven't been so nice to my employees at times, and no matter what I did to try to say to him that there's a lot of people that drink too much and might not be so nice to their employees, but they don't have cancer. I don't think this is a matter of deserving something like this. He wouldn't buy it. And we spent many months together just talking about, how do you feel about yourself? And, why is it that we're so hard on ourselves? And could we expand our view of this a little bit and take a bigger view at what's going on? And he really listened. To his credit, it was pretty beautiful the way he really wanted to heal and he wanted to understand, but he just was so caught in the self-blame, he couldn't get out of it, right? So we spent a lot of time, we talked about different things to do. I do a lot of work with mindfulness and meditation and yoga, breathing and nutrition and all the lifestyle things that we know are so important. And one day he walked into the office and he says to me, I had a massage at the cancer center today and it was amazing. And I said, that's great. And without stopping a beat, he said, and I deserve it. And that was the turning point. It's like he just took it on. And he just started doing all these things to take care of himself and to really look at what he could do to heal, how he could work in the world. So he took this on, and he wound up going on solo boat trips to the Northeast. He would send me texts. I would send him a text saying, "How are you?" And he would send me a picture back up at Bogus Basin with him with the infusion tank hanging from his arm on the chairlift saying, "Highest infusion in the valley today." And he's smiling, and he would say, "Notice the sun radiating off of my face." So he was noticing the beauty around him even while he's getting chemotherapy, right? And then I would, write back in a few weeks and, "How are you?" This went on for probably, he lived for 3.5 years. And he lived fully. He flew his plane, and he learned new things. And whenever I'd write to him, I'd say, "How are you?" And he'd say, "Loving life like never before." A month before he died, I wrote to him, "How are you?" And he said, that's when I think he said, "Loving life like never before." And it was so beautiful to see how he was able to take all that, and he died, but he healed. And there's sort of that paradox at times, but he truly lived. Yeah.
Wow, that is amazing. Wow.
And that's him. I want to clarify that I'm not I don't have any magic ideas or anything like that. I don't have answers to all these things. One of my favorite teachers is a teacher that says, "I have a lot of opinions, but no answers." And I would put myself in that category, right? I'm going to give you my best thoughts, but they're opinions, right? And, but helping patients to find that within themselves and to activate their own healing and to feel nourished and connected in their world. Another one of my favorite teachers, when we would talk about what is healing and how do you help patients, he said to me one time, if a patient walks into your room and they've got, let's say, a shoulder or an elbow injury or something, and you work with them and you give them the best you can, but they walk out of that room and they feel even the tiniest bit more connected to whatever is important to them, your work has been done. The elbow may still hurt, but if they feel that sense of meaning and connectedness and well-being. A patient came in the other day who has fibrotic lung disease, and he was told that this is going to kill you, and that it's going to be a slow and painful downward course. And my comment to him was, "Do we know that?"
Yeah.
That's a guess.
Yep.
That's based on current science or certain studies or certain statistics. Do we know that's true for you? And I remember him just sitting back in the chair just going, "No." And he was grappling with the fear. Like, who wouldn't? Exactly. Who wants to think that's what's going to happen to them? And just like you say, the possibility that there's some other other option, that it may go in a different direction. We don't know a lot of these things. We don't understand a lot of these things. For years we didn't understand acupuncture, right? So if we just limit ourselves to what we have studies about, we're actually not, looking at the full scope. So, yeah. And the patient should always be in the driver's seat. That is their right. We're the advisors. Physician means teacher. We teach what we know, hopefully with a lot of respect and humility, but then they get to decide, and they should. In my opinion, they should. I think if we can focus on health rather than disease, if we can teach people how to access that ability to enhance their own health. If we can do that as a community, I think that's a big part too. I think we need each other to do this work. It's not just sending the patient off to figure it out. It's that we come together. It takes a village to heal, right? I think when we can do that, when we can take care of ourselves and each other in that way, I think that so much healing can happen. But I also think that we need to stay true to that. So there's so many things in our system that are not working right now. And I believe that we need to really align ourselves with this intention, this vision of helping others to heal themselves, helping ourselves to do that, trusting the body and its wisdom to help us do that, you know, integrating with nature and all the different things around us to get there. So I think it's so important not to lose that alignment with that. And so the work that you're doing, that other people are doing, going out and starting DPC clinics and things like that, it's a way of saying, this is too important. This is what is so important in the world. And if we're going to heal each other and heal our world, we really need to come together in this way and stay aligned with this and help each other get there. Stay open, like you say, to the possibilities.